Hello everyone. September being the PCOS Awareness Month, we thought we will address some of the questions that most often people ask us to in our work. Though there is a lot of information out there, we get a lot of questions most often. So we thought we will share some with you. And I'm Rashmi Gopal. I'm an integrative nutrition health coach. And we have Dr. Anupama here, Ayurvedic fertility expert from Shrestha Ayurveda. Welcome, Dr. Anupama.
Hello, Rashmi.
Doctor, people are often confused whether this is PCOD or PCOS. Are both the same? And how do you diagnose it, doctor?
Okay, I do hear this a lot, this question about whether I have PCOS or PCOD. In the Indian scenario, we usually use PCOS and PCOD interchangeably. Basically, we are talking about PCOS only because PCOD is just what happens in the ovary alone. But in clinical practice, we hardly see anybody who has problems only in the ovaries. It is already, by the time we see it, is already systemic. Okay, so that is what PCOS means, polycystic ovarian syndrome, where it is systemic. Okay, PCOS is an endocrine metabolic disorder. Unfortunately, the numbers are rising in India. Among the reproductive age, as of now, one in every six females in India seem to have a diagnosis of PCOS, and many of them may be the rest may be undiagnosed too. So this is happening right now, and also there is so much confusion and overload of information out there, and people are not very sure how the diagnosis is made. And sometimes I see, they just walk in with a scan saying that, everything is normal. So my insulin resistance or my hormone problem cannot be because of this. So basically, I would say you will need three things, three main things to get a diagnosis. So what I do in my clinical practice is first an ultrasound scan, okay, where we see how the ovaries are looking. Are they bulky? And how many? Polycystic basically means many cysts. Okay, they're completely different from the ovarian cyst. These are um, cysts formed because of not being able to ovulate, which is very common in PCOS cases. So all these data, what is the ovarian volume? That is a bulkiness. And how many cysts are we seeing? Multiple cysts are we seeing in the and in the cortex or in the ovaries. And how does the ovary look overall, the stroma and the cortex and all that? We get all this information from a scan. And the second one is we should do a blood test to find out what are the hormone changes which have happened. So we basically keep saying that, there's hormone imbalance, but not every PCOS patient will have the same kind of imbalance between the hormones. So it makes a lot of sense to actually list out the hormones and take a blood test and see whether it is matching with the findings of the scan. And the third is what I see in the patient, like irregular periods, acne, hair fall, hirsutism, that is facial hair, and all these. And we have to match all this and see the bigger picture before labeling somebody or diagnosing somebody as having PCOS. So we should not forget any of these three steps. It's very, very important. This is how I diagnose. So I do all of it, and I do not diagnose PCOS in a hurry unless I get all these 3 points together where I can match each other and come to a diagnosis. This is what I do.
Fantastic, doctor. I think this gives a lot of clarity to a lot of people.
Yeah, I hope so because I see blood tests done, but not the hormones are not checked, and also in some cases where the patient is not overweight. Okay, 70% of PCOS patients are overweight or obese, but 20 to 30% of them are not. They could have moderate to lean BMI, lower weight as well. In such cases, they are told that they cannot have PCOS because the blood tests are not done. For example, in the obese PCOS, we see more of the hormone imbalance in insulin. Okay, but in other cases like lean PCOS, we may probably see it in prolactin. Okay, it is possible. So all of this have to be seen, and then the diagnosis has to be made, and like we can in the diagnosis itself, we can see there are so many types. So obviously the treatment also will vary, and there is no one size fits all a kind of remedy or treatment for PCOS at all. It has to be extremely personalized.
That's right.
Coming to your work, Rashmi, I'm sure you're seeing a lot of PCOS patients who come to you for help. What are the most common mistakes women are making after they have had a diagnosis of PCOS? What do you see regularly in your practice?
Yeah, most often, doctor, people are asked to lose weight when they have PCOS, and they resort to unhealthy ways of losing weight, unhealthy diets, crash diets, where without understanding whether they have insulin resistance or, like you mentioned, lean PCOS, there are other ways, or whether they have to start with managing their stress. So
Correct.
you have to start from where the root is, and gut health issues are most common in PCOS patients. So I think the first step to start is to improve their gut health. And also, most common mistakes that I see that people do is they add a lot of protein into their diet, or add a lot of supplements into their diet without really resolving their gut issues first. So first of all, the gut has to metabolize the protein that they are taking. So they have to first, resolve the inflammation, and then provide an environment for the gut to absorb all these nutrients. And then,
Correct.
it starts to, yes, of course, protein helps a lot with PCOS, but the first step is to start working on the gut health. So
Correct. Yeah.
So people
Um,
resort to unscientific smoothies and juices, raw salads, even when they don't know whether it's suiting them or not. So this is another pattern that I've observed. So it has to be very customized to their case, individual case, and their lifestyle, their age, everything has to be considered first.
yeah. Yeah. So they resort to many of these things which they see out there on social media or on ChatGPT, and they start doing it, and they get even more frustrated when these things don't work, because PCOS itself is quite a frustrating condition because it is, multi-systemic. So there is hair falling away, there's acne on the face, for no apparent reason you're gaining weight. You don't seem to, get a hold of a proper gut health. And I'm sure you have seen that after you do your gut reset program, there are so many changes, not only physically but also mentally, and the kind of breathing practices and meditation techniques you teach. It goes a long way in helping PCOS patients. Yeah,
Definitely, doctor. We've
yeah,
seen a
yes,
lot of them improve their health overall with PCOS and manage their PCOS symptoms much better.
much better. Yeah, yeah, yeah. Let us address more of these questions. Let's come back, and people who are watching this can send us questions if they have any specific questions, and we'll address them in the forthcoming videos. Yeah.
Yeah. Thank you, doctor.
Okay, Rashmi. Bye.